ACF's Office of Planning, Research and Evaluation, or OPRE,
The OPRE logo appears against a blue background.
builds evidence to improve the lives of children and families. This includes conducting research and evaluation related to home visiting.
Photograph. 2 older women sit on a gray couch alongside 4 young girls wearing bright colors. Everyone is smiling at the camera.
Home visiting is a service delivery strategy that aims to support the healthy development and well-being of children and families.
An animation shows a home visitor sitting at a table with 2 documents in front of her as she talks with a mom and young girl.
Home visiting involves families partnering with home visitors and working one-on-one to set and achieve goals that improve the family's health and well-being.
Photographs. A home visitor wearing a badge sits on a gray couch with a pen in her hand and a notebook in her lap. She speaks with an older couple sitting across from her. A home visitor wearing a yellow scarf sits at a table facing and listening to a client sitting next to her. She's writing notes in a notebook. A mom sits with her feet up on a beige couch and smiles at an infant she is holding in her lap.
Federal investment in home visiting greatly expanded after the Maternal, Infant, and Early Childhood Home Visiting (MCV) program was created in 2010.
An animation shows a box labeled MCV Program. Alongside the box, the phrase Maternal, Infant, and Early Childhood Home Visiting Program emerges and flies off screen.
MCV is administered by the Health Resources and Services Administration, or HRSA, in collaboration with ACF. HRSA administers the grants to states and territories, and ACF administers the Tribal MCV program.
The animation moves the box labeled MCV Program center screen. 2 boxes labeled Health Resources and Services Administration HRSA and Administration for Children and Families ACF appear on either side. The animation shows 2 arrows pointing down from the 2 boxes to 2 new boxes labeled Grants to Tribal Programs and Grants to State/Jurisdiction Programs.
The MCV program supports home visiting services in all 50 states, the District of Columbia, and 5 U.S. territories. And the Tribal MCV program supports home visiting services in tribal entities located across the U.S.
The animation transitions so the boxes labeled Grants to Tribal Programs and Grants to State/Jurisdiction Programs appear next to an animated map of the United States and its territories.
In general, home visiting involves 3 main intervention activities.
An animation zooms into a home through an open door and reveals a home visitor, mom, and young girl sitting at a table. The home visitor discusses some documents.
Assessing family needs, educating and supporting parents, and referring families to needed services in the community.
Photographs. A man, woman, and young girl smile at each other as the man carries the young girl on his shoulders. The words assessing family needs appear in a box. A dad looks down at a newborn sleeping against his shoulder. The words educating and supporting parents appear in a box. A young girl sits on her mom's lap at a doctor's office, and a doctor hands the mom a piece of paper. The words referring families to needed services and communities appear in a box.
Home visiting programs aim to improve a wide range of outcomes including maternal health, child health and development, child maltreatment prevention, and family economic well-being.
An animation shows a home visitor and a mom kneeling opposite each other while a baby crawls between them on the ground. 4 boxes labeled maternal health, child health and development, child maltreatment prevention, and family economic well-being pop up.
OPRE's home visiting research and evaluation portfolio is shaped by a learning agenda, co-created in close partnership with HRSA and the Tribal MCV program.
The animation changes to a woman sitting at a table and holding a pamphlet while 2 men and another woman nod and discuss.
OPRE uses a process called active engagement to develop and revise learning agendas and projects. Active engagement is the intentional involvement of groups and individuals who are invested in the findings and outcomes of research and evaluation, such as home visitors, families, program administrators, and model developers.
The animation changes again, forming a flowchart around the words active engagement in the middle of the screen. Word bubbles emerge with arrows pointing clockwise. The word bubbles read identification of learning priorities, planning and design, data collection, analysis, dissemination, and application and next steps. 4 illustrations appear around the flowchart. A home visitor stands and talks with a man above the words feedback from program partners. A whiteboard displays abstract drawings above the words input from grantees. A group of 4 people sit and talk at a table above the words technical workgroup meetings. And a home visitor with a speech bubble talks about an idea above the words consultation with subject matter experts.
Active engagement can improve the rigor of research and evaluation, facilitate the uptake of findings, and increase our capacity to promote equity. OPRE's home visiting portfolio includes projects answering questions related to understanding participants' experiences and outcomes, the home visiting workforce, and home visiting program implementation and effectiveness.
A new animation shows a whiteboard with abstract drawings. Two parents and a young child huddle happily beside the whiteboard, while a home visitor presents the information on the whiteboard. The animation changes to 3 home visitors standing in the center of the screen. The animation changes again to show a home visitor and a mom kneeling opposite each other, while a baby crawls between them on the ground.
OPRE also leads multiple projects that support capacity building in the home visiting field, and in particular for home visiting in Indigenous communities.
Photographs. A man places his hand on a woman's shoulder as another man shows him a piece of paper. All 3 people smile. 2 young women face each other talking. The woman in the forefront purses her lips. Several women sit in a circle while one woman facilitates a discussion.
Learnings from these projects support continuous improvement in the development and implementation of OPRE research, McVie and Tribal McVie programs, and the field of home visiting.
The OPRE logo appears in an animation. Documents follow 2 dotted lines to illustrations across the screen. A classroom with 3 desks and chairs appears above the words McVie Tribal Program and Grant Recipients. A building with 2 large glass doors appears above the words McVie Program Grant Recipients. And a house with a white picket fence appears above the words Field of Home Visiting and Interested Parties.
Explore what we are learning about home visiting and the children, families, staff, and programs supported by the McVie and Tribal McVie programs on the OPRE Home Visiting topic page.
The OPRE logo moves and replaces the documents and illustrations. The screen shows the web address for the home visiting topic page, acf.hhs.gov/OPRE/topic/home-visiting.